Listen up because I'm about to say what few people have the guts to tell you. They might give you polite smiles in the waiting room and pat your hand reassuringly, but the truth is that doctors, hospitals, and even well-intentioned caregivers sometimes hide crucial information from older patients like you. They figure you'll either be too afraid or too overwhelmed to ask the right questions, so they give you half-truths or no truths at all. Well, I'm not going to hold anything back. Today, I'm ripping the lid off 6 hidden medical realities that could make or break your health in your 70s and beyond. This won't be pretty, and it won't be polite, but you deserve every scrap of honest information. The first uncomfortable truth is that most doctors aren't trained to spot how common medications interact dangerously in older adults. Everybody's heard about drug interactions, but folks assume the doctor has it all figured out. Think again. Not every physician is a pharmacist or a geriatric specialist, and the fact is that many seniors have multiple prescriptions from multiple specialists. One might be for high blood pressure, another for your arthritis, and maybe a third for depression or insomnia. They all add up, and if someone isn't paying attention, your combination can become a ticking time bomb. You might notice you're drowsy all day, or you can't sleep at night, or your memory is slipping faster than normal. Doctors might brush it off as normal aging, but that's not always the case. One solution is to demand a medication review at least twice a year and force your entire healthcare team to communicate. If you don't, you could be overdosing without even knowing it. Comment with the reverential hard truth if you've ever felt like your prescriptions are making you worse. The second hidden truth doctors don't trumpet is that they often rely on outdated guidelines for older patients. Medicine advances quickly, but not every practice or hospital invests in the most up-to-date training or technology. Maybe your knee replacement surgery is based on old protocols, or the recommended therapy for your heart condition isn't aligned with current best practices. Sometimes doctors figure, well, at 75, how much difference does it make if we stick to the old methods? That's a harsh reality, but you need to hear it. It could literally be the difference between living comfortably and living in constant pain. Ask your doctor point blank, is this the newest recommended approach for someone my age? What are the alternative treatments? Don't let them shrug off your questions. If they sidestep, get a second opinion or a third, or however many it takes. Don't hand over your trust just because they wear a white coat. Demand answers. The third medical secret is that many healthcare providers don't address mental health, even though it can make or break your physical health. Anxiety, depression, and isolation in seniors are skyrocketing, yet doctors frequently ignore these factors or consider them a side issue. Sure, they'll ask if you feel sad, but you can almost guarantee they won't delve deep. Why? Because mental health treatment can be time-consuming, and many health systems reimburse them more for quick physical checkups. The brutal truth is that they might toss you an antidepressant prescription and send you on your way without exploring therapy, support groups, or other interventions that might actually help long-term. You need to advocate for your own mind because no one else will do it for you. Demand a referral to a mental health professional if you think you need one, and don't let your main doctor brush you off with a half-baked solution. If you're still listening, comment "Nyashar hard truth" because it's time we blow the whistle on these neglected issues. Now for the fourth hidden reality, doctors won't openly warn you how medical ageism can limit your treatment options. There's a dirty little secret in healthcare called therapeutic nihilism. That's a fancy phrase for doing less for older adults. Some providers assume that because you're over 70, you're automatically less likely to get better or benefit from advanced treatments. So they stay conservative to avoid risk, or they just figure you won't be around long enough to justify an expensive procedure. Don't let them undervalue your life. If your doctor dismisses your concerns or refuses to explore a more aggressive or innovative treatment due to your age, don't walk, run to a different provider. You deserve the same thorough care as anyone else. Age is just a number, and if someone is discounting your right to quality treatment, they don't deserve to be your doctor. The fifth harsh truth is that hospitals rarely mention the steep risks of hospital-acquired infections and complications for seniors. Let's face it, hospitals can be breeding grounds for bacteria and viruses. If you're older, your immune system is already weaker. You can pick up something nasty just by lying in that hospital bed for too long. Medical staff might not emphasize these risks because they're trying to maintain the institution's pristine reputation, or they assume you'll just accept hospitalization as a standard risk. Demand infection control measures. Ask if they've sanitized the surfaces in your room. Complain if they don't wash their hands before touching you. And if you don't absolutely need an extended stay, get the heck out of there. A longer hospital stay might do more harm than good, especially if it's a borderline situation where you could recover at home with proper outpatient support. Some doctors let seniors linger in the hospital because it's less hassle than organizing home health care. Don't let them sacrifice your well-being for convenience. If you want to share a personal story about hospital nightmares, comment "Just your hard truth" in the comments below. The sixth hidden reality doctors rarely disclose is that your test results might be quietly withheld if they don't consider them urgent. Lab results come back, but if it's not critical, some doctors don't bother explaining the minor abnormalities they noticed. So you might have a creeping thyroid problem, a vitamin deficiency, or suspicious lumps that are borderline. The doctor might figure, "We'll just watch it," or they'll bury it in your patient portal where you never see it. Before you know it, months go by, and that borderline problem morphs into a full-blown health crisis. Let me say this plainly. Not urgent doesn't mean irrelevant. It means a potential future catastrophe if you ignore it. The fix is surprisingly straightforward. Ask for a copy of every test result, not just the major ones. Sit down with your doctor and read through the findings line by line. Don't let them wave you off with "everything looks normal." Demand specifics, and if they're vague, push for clarity. You have the right to know your entire health picture, not just the parts they want to share, because the only person who's guaranteed to look out for you is you. By the way, if something like this has happened to you, where you found out a critical piece of information was buried in your chart, comment "Your hard truth." Finally, the seventh medical truth is that diet and lifestyle changes can be far more effective than doctors will admit. But they don't want to rely on that because it requires serious work on your end. Let's be real. Following a strict diet to lower your cholesterol, or a home exercise routine to manage arthritis, or mindful breathing to control blood pressure, it all demands discipline. Doctors know that you might find it daunting, so they hand you a pill instead. Now, I'm not against medication, obviously, but it's often the lazy first choice. The uncomfortable truth is that major dietary changes, adding daily movement, or drastically cutting stress can reverse or slow down multiple chronic conditions in seniors. But how many times has your doctor spent more than 5 minutes discussing nutrition with you? Probably never. Physicians are rarely given in-depth nutrition training, and insurance doesn't pay them to counsel you about how a walk every day could do wonders for your mood and mobility. Yet for many conditions, this approach can be more beneficial and far safer than pills. If you want a better life, you have to be the one to push for these lifestyle solutions, because odds are they won't come from the doctor. Now let's recap the 6 big truths we just laid out. Doctors can fail to catch dangerous drug interactions. They can use outdated methods without telling you. They'll often overlook mental health. They'll treat you differently because of your age. They understate the risk of hospital complications, and they might bury your test results if they're not screamingly urgent. Finally, the hidden bonus is that they won't emphasize how powerful proper diet, physical activity, and stress reduction can be. If you're sick of being kept in the dark, smash that subscribe button right now, because you deserve more honesty. It's not about scaring you, it's about waking you up so you don't live the last decades of your life in ignorance. Remember, no one is going to fight for your health like you will, not even the best doctor in the world. You need to ask pointed questions, demand second opinions, and push for the truths that no one else dares to reveal. Now let's unite and help each other out. Comment, Shucks your hard truth if any of these 6 realities made you realize you've been kept in the dark. Share this video with other seniors who deserve to know that they're not alone in facing medical half-truths. It's time to shine a spotlight on what's really happening in those exam rooms. Aging is tough enough without doctors sugarcoating facts or leaving out critical details. So let's fix that right here, right now. The uncomfortable truths are out in the open, and your move is next. Demand real answers, push for real solutions, and reclaim control of your health journey. I'll see you next time, and until then, keep fighting for the honest care and respect you deserve.